Candida esophagitis by Valeria Bastidas. Candida esophagitis is a yeast infection of the esophagus, the tube that carries food from the mouth to the stomach. Causes: Candida esophagitis is caused by yeast Candida. It occurs when the yeast spreads from the mouth down the esophagus. The condition is often a sign of a weakened immune system. The following raise your risk for Candida infections: HIV, AIDS, chemotherapy, diabetes, leukemia or lymphoma, organ transplants, other conditions that suppress or weaken the immune system. If you have a weakened immune system, thrush in the mouth, oral thrush, makes you more likely to get Candida esophagitis. Symptoms: difficulty swallowing, fever only if the fungus spreads further, oral thrush, Candida in the mouth, and painful swallowing. Treatment: in most people, antifungal medicines such as fluconazole, taken by the mouth, or amphotericin, given by injection, can control the infection. Some people also need pain medicine. Many patients need other long-term medicines to suppress the fungus and prevent another episode. Possible complications such as holes in your esophagus, perforation, recurrent infection.
Candida esophagitis is the topic, and I'll talk about esophagitis in general, and then I'll touch base about Candida more specifically. Esophagitis, as you can deduce, is essentially inflammation of the esophagus, and the esophagus, of course, is the tube that connects the mouth to the stomach. In terms of etiology, the causes of esophagitis vary a lot, but the two most common in terms of licensing exams tend to be Candida, which is of course the yeast, and herpes, which is a virus. There are other causes, of course, such as GERD, chronic gastroesophageal reflux disease, chronic nausea and vomiting, and also certain medications, such as aspirin, can also cause this inflammation. So what are some of the symptoms of esophagitis? Well, most classically you have difficulty swallowing, dysphagia. You can also have odonophagia, which is essentially pain during swallowing, although odonophagia is a very serious symptom and sometimes leads you to think of throat cancer rather than just basic inflammation. Heartburn, of course, is a classic symptom, and also the patient can also have nausea and vomiting. In terms of diagnosis, the best way really to visualize esophagitis is by doing an EGD, which stands for esophago-gastro-duodenoscopy. And I have a picture that I'd like to show you, and here it is, of essentially a snapshot of a patient that has Candida esophagitis. This is what was seen when an EGD was done. These white areas, of course, are the Candida, and as you can see, it's pretty characteristic. Other tests that can be done are a biopsy and a barium swallow. A barium swallow followed by X-rays will be able to detect anatomic abnormalities such as fistulas or something Well, the treatment, of course, depends on the etiology. Are you treating a fungus? Are you treating a viral cause? And also, certain medications such as PPIs, proton pump inhibitors, will help reduce the acid that is sometimes the cause of the inflammation. So I wanted to now touch base briefly about Candida esophagitis. Most clinical vignettes on the licensing exams will talk about Candida esophagitis in the context of an HIV-positive patient, because up to 20% of patients with HIV can have Candida esophagitis, in particular when their CD4 count drops below 100. And the species' full name is Candida albicans. And really, a lot of the symptomatology that I talked about before is applicable, and so is the diagnostic studies. The EGD, of course, will show this classic white exudate. The treatment really is any antifungal, any of these azole medications, and most commonly you're looking at fluconazole.
Prevention. Preventing HIV/AIDS lowers your risk for infections such as Candida. Good oral hygiene can reduce the risk of infection. Thank you.